today's session we will be discussing the important points related to the soft palate and pharynx. Okay, so let's see one case scenario. Okay, so a tumor invading the jugular foramen, okay, at the base of the skull, damaging one or more cranial nerves in this area. Okay, during examination, when the soft palate is elevated, uvula deviates. Okay, uvula deviates to the left side. Okay, the question is which nerve is most likely to get injured or involved by the tumor growth? By the tumor growth, that's the question. Okay, so the key word here is deviation of uvula to the left side. So remember, so the uvula is supplied by vagus nerve. Okay, uvula is a part of soft palate. Okay, uvula is a part of soft palate which is supplied by vagus nerve. Okay, so if there is injury to the right vagus nerve, okay, if there is injury to the right vagus nerve, the uvula will be deviating to the normal side, that is left side. Okay, so the answer for this question is right vagus. Okay, so see this diagram. Sometimes this question may be asked as image based. Okay, fine. So you are able to see the oropharynx. Okay, this is the soft palate. Okay, oropharynx, soft palate you are able to see, and this is the uvula. Okay, this is the uvula which is more deviating towards the right side. Okay, uvula deviating towards the deviation of uvula towards the right side, isn't it? So in this diagram, this is right side, this is left side, right? So this may be asked in image based also. Okay, so remember the deviation of uvula, okay, towards one side is due to injury to the nerve of the opposite side. Okay, so that is the concept here. Okay, this is the uvula which is deviating to the right side. That means which nerve is getting injured in this condition? Left vagus nerve injury. Okay, left vagus nerve injury. In left vagus nerve injury, uvula deviates to normal side. Okay, normal side, that is unaffected side, whatever, normal side or unaffected side. Okay, that means obviously left vagus nerve injury means normal side is right side. So uvula deviates to the right side. Okay, as you are seeing here. Fine. So in this question they have given uvula deviates to the left side. Okay, so the nerve injured is right vagus nerve. Right vagus nerve. Okay, fine. Okay, now see this diagram. We are able to see the hard palate. Okay, this is the hard palate, and behind the hard palate you are able to see the soft palate. So this is the structure called a soft palate, this one. Okay, this is the structure called a soft palate, which is composed of muscles, 5 pairs of muscles. Okay, and you will be knowing this is the nose or nasal cavity, and this is the oral cavity. Okay, this is the oral cavity, and this particular organ is tongue actually, isn't it? In the oral cavity you are able to see the tongue. So separating the nasal cavities above and oral cavity below, we have the hard palate anteriorly and the soft palate posteriorly. Okay, so in this diagram you will be having the orientation which is front, back, anterior, posterior, superior, inferior and all, right? Okay, so actually the region I am marking now is called as, this region is called as nasopharynx. Nasopharynx. Behind the nose we have the nasopharynx. Okay, similarly behind the oral cavity, this region is called as oropharynx. Okay, fine. So what are the various muscles of the soft palate? Okay, what are the various muscles of the soft palate? I told there are 5 pairs of muscles present in the soft palate, right? One is called as tensor palati. Okay, then we have the levator palati muscle, then we have the palatoglossus muscle, palatopharyngeus muscle, and the musculus uvulae. These are the 5 pairs of muscles of the soft palate, 5 pairs of muscles of soft palate. Okay, tensor palati, levator palati, palatoglossus, palatopharyngeus, and musculus uvulae. Okay, and out of these 5 muscles, this tensor palati is the muscle which produces the broad structure called as palatine aponeurosis. Okay, so out of the 5 muscles we have discussed now, okay, all muscles, actually all muscles of soft palate, okay, they are supplied by pharyngeal plexus of nerves. Okay, supplied by pharyngeal plexus of nerves. Otherwise, we can say cranial part of accessory nerve by joining with via vagus nerve. Okay, so simply we can say vagus nerve supplies all the muscles of soft palate, or you can say pharyngeal plexus of nerves will supply the soft palate. Okay, except in idea, except which muscle? Yes, except tensor palati muscle, except tensor palati. So what is the nerve supply for the tensor palati? Yes, tensor palati is supplied by mandibular nerve. Okay, so all the muscles of soft palate are supplied by pharyngeal plexus of nerves, or else we can say cranial part of accessory nerve via vagus nerve, except tensor palati. It is the only muscle of the soft palate supplied by mandibular nerve. Mandibular nerve. Right? And one more important thing is, as I told, this tensor palati muscle is the one which forms one broad structure called as palatine aponeurosis. Okay, so palatine aponeurosis is formed by the tensor palati muscle. Okay? And one more important thing about the soft palate we have to remember is the taste sensation. Okay, taste sensation from the soft palate. Taste, otherwise we can say special sensation. Okay, special sensation from soft palate is carried by which nerve? This has been asked. Okay, the answer is greater petrosal nerve. Okay, taste sensation from the soft palate is carried by greater petrosal nerve. And I hope you will be knowing this greater petrosal nerve is a branch of facial nerve, 7th cranial nerve. 7th cranial nerve, that is facial nerve. Okay, so take care of this point. So if the question is the muscles of the soft palate are supplied by, the answer is vagus nerve or pharyngeal plexus of nerves. Okay, if the question is special or taste sensations from the soft palate is carried by, the answer is greater petrosal nerve, which is a branch of facial nerve. Okay, so now we are going to talk about the important points, discuss the important points about the pharynx. Okay, so first of all, I want you to know the extent of the pharynx. Okay, what is the extent of the pharynx? Pharynx extends from the base of the skull to the cricoid cartilage. Okay, that's what mentioned here. It extends from base of skull to the lower border of cricoid cartilage, and the vertebral level of lower border of cricoid cartilage is C6, 6th cervical vertebra. Okay, so this is about the extent of the pharynx, vertical extent of pharynx from the base of the skull to the lower border of cricoid cartilage, that is C6 vertebral level. Okay, and remember the pharynx. Okay, it is surrounded by 3 constrictor muscles. Okay, 3 constrictor muscles from above downwards, named as superior constrictor muscle, middle constrictor muscle, inferior constrictor muscle. Okay, so these are the 3 constrictor muscles of the pharynx, above downwards: superior constrictor, middle constrictor muscle, inferior constrictor muscle. Okay, and what is sinus of Morgagne? Yes, it is the space or gap between base of skull. Okay, between the base of skull and superior constrictor muscle, there is one gap or space defined as, called as sinus of Morgagne. Okay, so sinus of Morgagne is the gap or space between base of skull and superior constrictor muscle. Okay, fine. Now you will be knowing the 3 parts or 3 subdivisions of the pharynx. What are they? Yes, according to the location, behind the nose we have the nasopharynx, isn't it? Behind the oral cavity we have the oropharynx, isn't it? And behind the larynx, we have the laryngopharynx. Okay, so these are the three parts of the pharynx from above downwards: nasopharynx, oropharynx, laryngopharynx. The laryngopharynx is otherwise called as hypopharynx. It is located below, so it is otherwise called as hypo means below, right? Hypopharynx. Fine. Now see this diagram in order to understand the various tonsils present in the pharynx. Okay, so already we have studied, this is the nasopharynx. Okay, behind the nose, this is nasopharynx, outline of nasopharynx. Okay, so in the nasopharynx we have two types of tonsils. Okay, one is called as tubal tonsils. Surrounding the tubal opening, this is the tubal opening. Surrounding the tubal opening, we have the tubal tonsils. Okay, then we have the pharyngeal tonsils. Okay, and when you talk about the oropharynx, okay, this is the outline of, rough outline of oropharynx, isn't it? Oropharynx. Okay, fine. So in the oropharynx also we have two types of tonsils. Okay, one is called as lingual tonsils present in the tongue, posterior 1/3 of tongue, and this is called as palatine tonsils. Related to the soft palate, we have palatine tonsils. Okay, so what are the four types of tonsils present in the pharynx? Yes, number one is tubal tonsils. Number two is nasopharyngeal, or simply called as pharyngeal tonsils. Nasopharyngeal, or simply called as pharyngeal tonsils. Okay, and related to the oropharynx, we have two tonsils. Number three is lingual, located in the tongue, so called as lingual tonsils, located in relation to the soft palate. We have the palatine tonsils. Okay, palatine tonsils, and this palatine tonsils are simply called as tonsils. Okay, the tonsils or tonsils. So these are the four types of tonsils we have. Okay, tubal, nasopharyngeal or pharyngeal, lingual, palatine tonsil are simply called as tonsils. Okay, and remember all these four types of tonsils I have told you now: tubal, pharyngeal or nasopharyngeal, okay, then lingual, then palatine tonsil. All the four types of tonsils, they form one ring-like structure. Okay, they are arranged in a ring-like manner. So this arrangement is called as Waldeyer's ring or Waldeyer's lymphatic ring. Okay, so remember the four structures together forming the so-called Waldeyer's lymphatic ring. Okay, if you want, you can remember as PTPL. Okay, pharyngeal tonsils, tubal tonsils, palatine tonsils, lingual tonsils. All the four types of tonsils, okay, they together form one arrangement, ring-like or circular arrangement called as Waldeyer's lymphatic ring. Okay, fine. Now, in this diagram, do you see the location of the palatine tonsil? Okay, so now we are going to talk in little detail about the palatine tonsil. Okay, number 4, that is palatine tonsil. So what is the location of the palatine tonsil? Yes, palatine tonsils are located in the lateral walls. They are located in the lateral walls of what? Oropharynx. Okay, palatine tonsils are located in the lateral walls of oropharynx, isn't it? Fine. So let's talk about the palatine tonsil, important things. Actually, in this diagram, this is the medial aspect, this is the lateral aspect. Okay, so you are seeing the palatine tonsil from front, anterior view. Okay, so do you see the medial surface? Okay, this is the medial surface. The medial surface of the palatine tonsil contains what? Crypts. Okay, the medial surface of the palatine tonsil contains numerous depressions called as crypts. Okay, crypts. Okay, and these crypts are lined by, okay, the crypts of the palatine tonsils are lined by what type of epithelium? Yes, non-keratinized stratified squamous epithelium. Okay, non-keratinized stratified squamous epithelium. Okay, and right now I am tracing the lateral surface of the palatine tonsil, which is lined by capsule, that green color capsule. Okay, and lateral to the palatine tonsil, we have the peritonsillar space, which contains one vein, namely paratonsillar vein. Okay, peritonsillar space contains the paratonsillar vein. Is it okay? Then lateral to the peritonsillar space, you are able to see the three main structures forming the tonsillar bed. Okay, the muscle which is forming the tonsillar bed is superior constrictor muscle, which is surrounded by two fascia, buccopharyngeal fascia and pharyngobasilar fascia. Fine. So these are the things we have to know regarding the palatine tonsil. Okay, and one more thing is the palatine tonsil is anteriorly bounded by palatoglossal arch, and the palatine tonsil is posteriorly bounded by palatopharyngeal arch. Anteriorly palatoglossal arch, posteriorly palatopharyngeal arch. Okay, which contain the same named muscles. Both the arches will contain same named muscles, palatoglossal muscle and palatopharyngeal muscle. Okay. Now, what about the arterial supply of the palatine tonsil? The main artery supplying the palatine tonsil is facial artery. Okay, facial artery is the main or chief artery supplying the palatine tonsils. Okay, through the tonsillar branch as well as ascending palatine branch. Okay, so the main artery is facial artery. Other than facial artery, lingual artery. Okay, then ascending pharyngeal artery. Okay, lingual artery, ascending pharyngeal artery, greater palatine artery, they will also. Okay, these are the four arteries supplying the palatine tonsils. Fine. Facial artery is the main artery supplying the palatine tonsils. Other than the facial artery, we have the lingual artery, ascending pharyngeal artery, and the greater palatine artery. Okay. Fine. Now, coming to the lymphatic drainage of the palatine tonsil. Okay, the palatine tonsil lymph drains into upper deep cervical nodes. Okay, palatine tonsils drain into upper deep cervical nodes, specifically mainly jugulo-digastric nodes. That is the reason jugulo-digastric nodes, otherwise known as tonsillar nodes or tonsillar lymph nodes. Okay, jugulo-digastric nodes are also known as tonsillar nodes or tonsillar lymph nodes because during tonsillitis, these lymph nodes will get enlarged. Jugulo-digastric nodes will get enlarged during tonsillitis. Okay, so please keep in mind. Okay, and what about the nerve supply of the palatine tonsil? Yes, the palatine tonsils are supplied by glossopharyngeal nerve, 9th cranial nerve. Okay, palatine tonsils are supplied by glossopharyngeal nerve. Fine. Okay, now see this diagram. You are able to see the uvula, which is exactly present in the midline. Normally, uvula is present in the midline. If there is injury to the vagus nerve of one side, then the uvula will be deviating to the opposite side. We have discussed, right? So see here, on either side of the uvula, are you able to see the two palatine tonsils here? Okay, and you can see the left palatine tonsil. Okay, left palatine tonsil is somewhat enlarged. That is called as tonsillitis. Okay, so during infection of the tonsils, palatine tonsils, they will get enlarged. The condition is called as tonsillitis. You will be knowing all these things, isn't it? Okay, so regarding the tonsillitis, okay, remember, if there is chronic tonsillitis, okay, there will be collection of pus around the tonsil. That is collection of pus in the peritonsillar space called as quinsy. So quinsy is the another name for the peritonsillar abscess. Collection of pus within the peritonsillar space is called as quinsy, peritonsillar abscess. Okay, then So if the palatine tonsils are enlarged due to infection and inflammation, you have to surgically remove them. Okay, what is the procedure of surgical removal of the palatine tonsil called as? Exactly, tonsillectomy. Okay, so during tonsillectomy procedure, the bleeding, hemorrhage or bleeding mainly due to injury to the one vein actually, okay, present in the peritonsillar space. What is that vein called as? Yes, paratonsillar vein. Okay, paratonsillar vein. Okay, so during tonsillectomy procedure, bleeding mainly occurs due to injury to the paratonsillar vein. Okay, it is not arterial bleeding, mainly it is venous bleeding, injury to the paratonsillar vein. Is it okay? Now, one more important thing we have to remember related to the tonsil is, okay, I told you already, the palatine tonsils are supplied by glossopharyngeal nerve, isn't it? So during tonsillitis or during tonsillectomy procedure, okay, pain may be, during tonsillitis or tonsillectomy procedure, pain may be referred to middle ear. Okay, pain may be referred to middle ear. Why? Because palatine tonsils as well as middle ear both are supplied by the glossopharyngeal nerve. Common innervation of palatine tonsil as well as middle ear by the glossopharyngeal nerve. Tympanic branch of glossopharyngeal nerve will supply the middle ear. Okay, and also remember, the glossopharyngeal nerve not only supplies the middle ear, okay, it also supplies the posterior 1/3 of the tongue, isn't it? Posterior 1/3 of tongue. Already we have studied when we talked about the innervation of the tongue. Posterior 1/3 of tongue, both general sensation and taste sensations are carried by glossopharyngeal nerve, isn't it? So if there is injury to the glossopharyngeal nerve, okay, there may be loss of general sensation as well as taste sensation. In which part of the tongue? Yes, in the posterior 1/3 of the tongue. Okay, because posterior 1/3 of the tongue, general sensation, taste sensation, both are carried by the glossopharyngeal nerve. Okay, so there may be decreased or entire loss, okay, complete loss of sensation from the posterior 1/3 of the tongue. Okay, and finally, I have told you there are 3 constrictor muscles of the pharynx, isn't it? From above downwards, superior constrictor, middle constrictor, inferior constrictor, isn't it? Remember, the inferior constrictor muscle, okay, contains 2 parts according to the site of origin. From the thyroid cartilage, we have the origin of the thyropharyngeus. From the cricoid cartilage, we have the origin of the cricopharyngeus. So thyropharyngeus, cricopharyngeus, both are the 2 parts of which muscle? Inferior constrictor muscle. Fine. And actually, there is one potential gap between the 2 parts of the inferior constrictor muscle, and that gap is called as Killian's dehiscence. Okay. So Killian's dehiscence is the gap, okay, between 2 parts of inferior constrictor muscle. That means between thyropharyngeus and cricopharyngeus. Okay, what is the disadvantage of the Killian's dehiscence? It is a gap, isn't it? Actually, this is the weakest part of the pharynx. Killian's dehiscence is the weakest part of the pharynx. So what will happen? Since this is the weakest part of the pharynx, if there is increased pressure within the pharynx, there may be herniation, okay, through this weakest part of the pharynx. That means herniation may occur through the Killian's dehiscence, that is defined as Zenker's diverticulum. So Zenker's diverticulum is the abnormal herniation. Okay, it is the abnormal herniation occurring through what? The potential gap called as Killian's dehiscence. Okay, so Killian's dehiscence is a normal potential gap. If there is herniation occurring through the Killian's dehiscence, it is called as, that herniation is called as pharyngeal pouch or Zenker's diverticulum. Okay, and remember this Zenker's diverticulum. See this diagram showing the 2 parts of the inferior constrictor muscle. Okay, And what is the gap between the two parts of the inferior constrictor muscle called as Killian's dehiscence. And in the second diagram, you are able to see through the Killian's dehiscence, there is one pouch coming out, diverticulum coming out. That abnormal herniation is called as what? That abnormal herniation is called as Zenker's diverticulum or pharyngeal diverticulum or pharyngeal pouch, whatever. Okay. So remember, this Zenker's diverticulum is a false diverticulum. It is not a true diverticulum. It is a false diverticulum. Okay. Because it contains, this herniation contains only two layers. It contains only mucosa and submucosa. The muscular layer is not coming out, not herniating. So only two layers are involved, not all the layers of the pharynx. That is the reason it is a false diverticulum. Okay, fine. And one more thing about Zenker's diverticulum, it is more common on left side. Zenker's diverticulum is more common on left side. Okay, it is more common on left side. Okay, fine. So the last question. Okay, this is the last slide actually. So try to answer this case scenario. Following tonsillectomy procedure, the patient complains of numbness at the back of tongue and reduced taste sensation from the back of the tongue. Which of the following nerves got damaged, okay, during this tonsillectomy procedure? Back of tongue means they mean posterior 1/3 of tongue. Okay, already I have told you, already we have discussed from the posterior 1/3 of the tongue. Okay, both general sensation as well as taste sensation are carried by glossopharyngeal nerve, isn't it? Which not only supplies the tonsils, also supplies the middle ear and the posterior 1/3 of the tongue. Okay, so obviously the answer for this question is glossopharyngeal nerve. Okay, glossopharyngeal nerve. What about the vagus nerve? Vagus nerve supplies the posterior most part of tongue, not posterior 1/3 of tongue, posterior most part of tongue. Okay. Okay, fine. What about hypoglossal nerve? Hypoglossal nerve is nothing to do with sensory sensation. It is a purely motor nerve actually. Okay, so it is not at all related to sensory. Okay, it is not carrying sensation. It is a purely motor nerve. Okay, it supplies all muscles of the tongue except palatoglossus that we have studied already. Okay, what about lingual nerve? Yes, you know, lingual nerve carries general sensation from anterior 2/3 of tongue. Okay, what about glossopharyngeal nerve? That is the answer for this question. Okay, we know glossopharyngeal nerve supplies the tonsils. Okay, not only tonsils, it also supplies the tympanic cavity, that is middle ear cavity. Tympanic cavity, otherwise called as middle ear cavity, isn't it? And also it supplies the posterior 1/3 of the tongue. Okay, fine. Okay, that's the end of the today's session. Thank you all.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.